Abdominal examination. So in retained products of conception, if this patient is septic, there's going to be marked suprapubic tenderness. The uterus is going to be subinvoluted because there are products inside, so it hasn't been able to contract down properly. And if not septic, there'll be mild to moderate suprapubic tenderness, because remember, the tenderness in a miscarriage that isn't septic, the pain is coming from contraction. So when you feel the uterus itself, it's not inflamed or tender. But you can usually feel a uterus or just the tip of a fundus coming above the pubic brim, because if somebody is bleeding to this extent that they're ending up in casualty, they're probably further along in their pregnancy, probably in the late first to and running into second trimester. So you could probably feel a uterus, especially since the uterus hasn't contracted down. It's got product sitting in there. Moving on to an ectopic. An ectopic is a radically different picture. So between your two pregnant patients who are in a gynae casualty, the picture is very different. Remember, the pain here is over the uterus. The pain here, and also this obviously translates to examination, is severe unilateral tenderness with all the features of peritonism. So rebound, guarding, which may be moderate or severe if the ectopic has completely ruptured. Likewise, with our PID patient, we are again talking about an acute abdomen, so severe unilateral, or like I said, it can be bilateral salpingitis, so it can be both iliac foci tenderness with rebound, guarding, and especially in grade 4, you will have full-blown peritonism, so there might be generalized severe rebound and guarding. And then in your patient with ovarian torsion, where the ovary is still currently torted and it hasn't untorted by the time they see you, they're going to have severe unilateral iliac fossa tenderness, which may or may not get worse when you squeeze on it, because remember, the mechanism is ischemia. So that pain is there whether your hand is compressing that or not. Whereas here, your hand is causing irritation on structures that are very inflamed. Here, your examining hand is causing pain on a structure that is rupturing. And here, if you're going to be causing pain, again, it's because of inflammation and in the case of a septic miscarriage. Our next whistle stop on the examination train is going to be vulva and vagina. We'll see you shortly for that.